You've got questions, we've got answers. Welcome to the Therapist Question Box, where trauma-trained therapists tackle real questions from real people. I'm your host, Lindsay, bringing you grounded insights you can actually use, brought to you by Therapy Utah. Welcome back to another episode of the Therapist Question Box. We are here to answer your tough questions. Whether the question's for you or you're just asking for a friend, we are here to help you navigate your mental health. Today I have with me Blake Adams. Blake, thanks for being here.
Great to be here.
Blake is a therapist at Therapy Utah, and he also actually works on the back end of the podcast. So it's awesome to have you here with us. Appreciate it.
Yeah, it's always great to be on this side of the camera.
For sure. Blake, tell us a little bit about you.
Yeah, so I'm a therapist at Therapy Utah. I've been here for coming up on 3 years. Primarily, I work on anxiety therapy, work with adolescents, do play therapy with kids as well. And then mental health is also kind of an interest and passion that I work with.
Nice.
And then occasionally couples. So I kind of do a lot of stuff, but primarily I like working with anxiety, pornography addiction treatment, things like that.
Nice. Okay. And then tell us about you. Tell us about who's Blake. What do you like to do? Tell us a little bit about you.
I like to be outside.
Yes, you do.
Yeah.
And you can see it by his videos, by the way. They're amazing.
Yeah, I absolutely love to just get out. I like to travel, but even just being around Utah, around the western United States, just finding different places to backpack and hike into.
With your dog?
With my dog, yep,
Yes.
with Django. He's a husky mix. He thinks he's a human, and it is really fun until it's not. But,
like a lot of our dogs.
Yeah,
we get that. Yeah.
But love photography, taking pictures, taking videos, flying my drone where I can.
Nice. That's awesome. My husband got a drone for Christmas, and I'm kind of in a love-hate right now. Mm-hmm. I'm like, he was flying it around the living room the other day, and the dog was freaking out, and the kids, and I thought, oh boy, that's why drones are meant for outside. They're just loud, annoying, but the pictures are amazing.
So fun.
Yeah, that's awesome. Very cool. Well, today we're talking about anxiety. We have a listener question that is about anxiety, and it's something that is near and dear to your heart and mine as well. So I'm excited that we can have this conversation. So here's the question. What I've learned about anxiety and how to help isn't working. What can I do differently?
Love that question.
I do too. I wish I could actually reach into that question box and get more information and say, okay, listener, what isn't working? What is it that you're doing right now that's not working? We don't know that answer. So let's see if we can figure out, maybe we can give some ideas about maybe what people traditionally do for anxiety and why it might not be working. So if you can start with that, Blake, what are some things people do traditionally for anxiety?
Yeah, well, what I can do is I can kind of share an example, just something that I've experienced that I think can kind of answer that. And this question is kind of near and dear to me because growing up, I struggled with pretty tough social anxiety. And people who knew me, some people definitely knew that. Some people that I was more comfortable with maybe wouldn't have suspected it. But people that knew me well definitely knew that. And so I ended up actually going to therapy when I was younger. And the therapist was awesome. He's an awesome therapist, really experienced. And we went through and he walked me through some different approaches. And at the end of the day, the approach was we need to learn to control your emotions. And what we're going to do to do that is we're going to repeat and get practice and just get a lot of repetition in controlling your emotions and putting yourself in situations where you can be exposed to feeling that anxiety.
So exposure therapy.
Essentially, yeah.
Okay.
That's kind of the concept. And so I had a challenge from that therapist, which was to go talk to, it was like 10 people, new people in the week, and just kind of force myself to do that and then follow up.
Okay.
Had I done that, I think I could have seen some results for sure. But I walked out of that therapy office, and you know what I thought?
No way.
I'm not doing it.
Yep.
And I knew that I wasn't doing it. And I absolutely knew 100% that it wasn't going to happen.
Yeah.
And you could, of course, be like, well, you're just, that's on you. You're just not tough enough to handle it. But if I think to my clients, if I was to ask clients that, I think maybe 25% of them would do it.
I agree.
And does that mean that the other 75% are just stuck with social anxiety for the rest of their life? Like, I don't like that answer very much.
Amen. It's interesting to me too, to say, okay, 10 people. I think anybody, by the way, meeting 10 people, that's a big deal. And then following up with them. I mean, that's a lot of effort, especially to someone with social anxiety, right? So you were like, yeah, I'm not doing this. That's not what, I don't see myself doing it. So what happened?
I didn't do it. Yeah, I absolutely. I just, I didn't. And I had this feeling that like, it was like a good approach, but it wasn't the heart of what the issue was. Like there was something that was just like unheard and unmet there, that wanted to happen, but just like for whatever reason just wasn't being figured out.
Yeah. I think what you just said is really important, is that the social anxiety was really kind of the behavior, what was happening, but underneath there was something else going on. Right. And that wasn't being tapped into. Yeah.
And I think that's the case for so many people that experience anxiety, is they just think it's, oh, man, like I can't figure it out. Like I've looked for these answers. Something must just be wrong with me. And there's an internal piece of me that's broken. And I have absolutely convinced that's not the case. I don't think people get broken. I don't think there's anything wrong with them. We just need to learn how to do things in a way that works for us. And so my approach to anxiety treatment is gone way different because of that experience.
Wow. It's actually so awesome. And I appreciate you sharing that with us, that you've had your own experience with it, because I agree with you. When you've had your own experience, you can look at it differently. You go, you know what? I would never do that. In fact, and you probably don't have your clients do that either, because you know it wasn't effective for you, right?
Yeah.
So looking at it and having compassion and saying, you know what? And obviously something else is going on, right? There's something else going on that's really causing this behavior, this social anxiety, right? So the pendulum has swung, you've said, and you have a totally different approach. So tell us about that.
Yeah, so it all starts, I think, at understanding what anxiety is. And what I'm going to do is I'm going to explain my understanding of anxiety. And this is not, there's people that will view it differently, that will treat it differently. There's therapists that will give you a different explanation. And maybe those will work. I've just learned that this is kind of what makes sense to me.
Okay.
And has made sense to a lot of clients that I work with. So I'll ask you, traditionally, how would you explain what anxiety is? And then we can go from there.
Gosh, that's a good, you're asking like traditionally, what have I thought about anxiety? Because again, this is near and dear to my heart too, as a fellow anxiety sufferer and one that has worked through it my whole life. I would say it's worry. I mean, at the very basic level, it's worry. And it's worry, worst case scenario, what ifs. I mean, that's what my anxiety was and what I understood it to be, that I just couldn't stop worrying.
Yeah. And I know there's a big approach within therapy as well that treats anxiety as an emotion in itself.
Right.
I think there are definitely some advantages to doing that, but what we need to do is we need to get clear on the difference between stress and anxiety. So oftentimes people associate anxiety with stress, and there's a lot of overlap and crossover. The simplest way that I found of looking at it is that stress is a reaction that we have to an external factor, an external occurrence. Something happens outside of us and we have to react to it. Anxiety is a reaction to internal rumination. And so
that's a great differentiator. I've actually never heard that before. Stress is exterior and anxiety is interior, is like something inside. Yeah.
Correct.
Internal rumination. That's great.
And this is why I feel like that challenge to go talk to 10 individuals wasn't working, because that was just introducing me to stress. And it's just stress. And stress is not a bad thing. And it's important to learn how to overcome stress. That's a really important thing that we do in life. When I was in basic training, I had a crash course in stress for 2 months. And it was a really good thing for me to learn how to cope with. But anxiety, on the other hand, it's an internal thing that occurs because we are not using tools exactly how we should be using them.
Okay, can we back up a little bit? Because one thing you said I think is important in understanding it. You said stress is external, anxiety is internal. Now, with your example of going to talk to those 10 people, and you said it was external But I would imagine that external stress probably caused some internal stress as well, some rumination and anxiety. Would you agree?
Yeah, it can absolutely trigger trigger anxiety, I would say, kind of be like an originating factor of it.
Yes.
But if we look at anxiety, here's in its basic form. We'll do this. I'll throw out this example that I often use with clients. So if you think of your mental thought energy in terms of past, present, and future, and a percentage of how much mental thought energy you put into the past, the present, and the future, what would you think would be maybe an average for a client that you work with?
Is this a client with anxiety?
Yeah.
I would say far more worry in the future.
Yeah. So maybe you're seeing, I mean, I've heard as high as 80% in the future.
Wow.
We're seeing 80, and some people, especially people that have gone through traumatic experiences, end up reporting a lot in the past as well. And that's interesting because past experiences also channel into worrying about future events.
Absolutely. Yeah. Again, which is why when there's a trauma experience, it really shapes not just the present, but it shapes your past as well as your future, right?
Yeah, absolutely.
So that's again, understanding, okay, when people are anxious, they're not in the present moment. They really are worried up to 80% about what the future holds for them.
Yeah, absolutely.
So really considering that, okay, we're in the future focus. How do I change that? How do I you could say that to somebody and they go, okay, yeah, I hate it. What do I do about it? I can't figure out my thoughts. I don't know what to do. What would you say?
Yeah, well, we need to understand what's happening because there's a lot of people that I think are very hesitant to let go of the future, of worrying about the future. And it's valid because of what could happen, because of I got to be ready for that future event, for this social event that I have. I need to be ready for all the possibilities, all the things that could happen. This hard conversation with someone I care about or a coworker, like I got to anticipate what they might say so I can respond to it.
Yes.
So we end up spending just an absurd amount of time in all these future possibilities. And how often do we get it right down to the T?
Rarely, if ever.
I don't think ever.
Ever.
Yeah, I really
to
don't.
the T, certainly not ever. Yeah. But it's our bodies and our minds trying to help us. Right? Trying to say, okay, I'm going to make sure that I have every worst case scenario, every what if taken care of. And so somehow that's going to make me feel safer. Right?
So that is the belief, right?
That's the
That is
belief, correct.
And I think that belief exists because as a society, we teach to logic things out. It's always logic, and solve it logically. We forget the most important side of our brains, which is, and I'm not saying logic isn't important because I am a logical person. I like logic, but the emotional foundation, the emotional base, right, in our brains, we cannot forget that. So when we spend all that time worrying about the future, we're ultimately just burning thought energy. We're just burning mental energy on something that will never happen, on something that is completely outside of reality. Same with the past. I mean, you think about it, what color birthday cake did you have this year?
Oh gosh, I have no idea.
Yeah, nobody does. But now that I've asked you, what are you going to think?
I'm going to be thinking about it.
What would you choose right now?
I would not choose cake because I hate cake.
Okay.
Well, I don't hate it, but I would choose a pie.
Okay, a pie.
Yeah.
And was it a pie? Yeah, we don't know. What kind of pie? Just thinking about it now, what kind of pie would it be?
A raspberry pie.
A raspberry pie. So going forward, that's your memory of your birthday. You had raspberry pie. Did you? I don't know.
Right.
Maybe you did, maybe you didn't. But that's how good our past memory is. And we spend a lot of time worrying about the past oftentimes too. And it's just not real. So we spend a lot of time in not real future, not real past. What's real is now.
Oh, that's so interesting that even the past isn't real because our memories don't always serve us. Our perception has changed. So really getting clear, okay, how do I get in the now? What does that look like? I think our listeners want to know that so badly. How do I stay present? How do I stay in the now and not ruminate about the past or worry about the future? It's a hard thing to do.
Oh, it's so hard. But the great thing is there's a simple answer to it. It does take some work and some shifting of how we approach things. But once it's done, everything becomes so much more vivid and so much more authentic.
Okay, tell me. I want to hear the simple answer.
Okay, the simple answer is we have to stop viewing emotions as the enemy.
Okay. Amen to that, by the way. Instead of them being the enemy, emotions are what?
Emotions are the tools that keep us anchored in the present.
Wow, I love that. Emotions are tools that keep us anchored in the present. Okay. I always say they're information, but that's better.
I mean, I think that's a good way of looking at it too. But this is my approach to it will be a little bit different. Everything's going to be work differently for different people. I love this approach though, because what it does is we take things like like anger, for example. I mean, traditional feelings about anger. So many clients that really don't like it.
Right.
They don't want to be angry, whether they've seen parents or family be angry, and their whole experience with it is this is a terrible, horrible thing.
Yep. And really saying, actually, it's not. It's actually anchoring you in the moment. And there's probably something to be angry about.
Yeah.
Turns out, right? And not having shame about those feelings. I think that's one of the biggest things is we feel uncomfortable with our discomfort.
Yeah.
And so we go, okay, then I'm going to go forward thinking, or I'm going to go back thinking. But I'm actually saying, nope, this is a tool that anchors me to right now. Even if it's uncomfortable.
Yeah, absolutely.
Good. So we got to be comfortable being uncomfortable because some emotions are not comfortable.
Yeah, they take practice.
Yeah,
for sure. And traditionally, I think they're with a lot of the approaches to anxiety that I've seen, and in one of two different results, either of which ultimately will treat emotions as the enemy. And one of those is when we see emotions as this these things that we just need to, like, kind of, as I talked about before, is we need to control them, right? Because emotions cause chaos and they cause discomfort. So we control them, we lock it down, and then we get way overly analytical about emotions. And this is more common in men, I would say, from just the clients that I've worked with. Very common for men to go to that place where emotions will betray me if I use them. So if I'm feeling strong emotions, I just got to step away. I just got to back out. I got to shut down.
Because it's safer that way.
It is.
Because I really don't want to show it. And so I'm going to back. Yeah. No, thank you. No, not interested in that. Yeah. It makes sense. Also, I would say as a society, we don't do a great job at allowing hard emotions.
Right.
We really say, oh no, look, we're going to take the easy way out. Here's the easy button. Here's a dopamine hit with your phone. Here's this, whatever, to try to just not feel what we're actually experiencing. I've heard it said, we have to feel to heal. And I really believe that. Like, that is our way through, but it's through. We can't go around it, under, over, whatever that old children's book is. We have to go through it. And sometimes that can be uncomfortable.
Oh yeah, it can be uncomfortable, but it gets easier when we learn how to use emotions as the tools that they are. Going back to anger, I think anger is absolutely the most underrated emotion. It is one of the most important that we do not teach. We don't teach it well. We teach it. Anger is something that you can't do it. You're going to hurt other people. You're going to ruin relationships. And in reality, anger is the emotion that saves and builds healthy relationships. Because at its core, what anger does is it establishes boundaries in relationships. If someone's like poking you in the head constantly over and over again, and you just don't get mad about it, you shut your emotions down, you're never going to have good boundaries. You're never going to have healthy relationships. You're always going to be dependent on other people.
Right. I was like, Blake, were you around my childhood with my older brothers poking me in the head? It was my forehead, right? Doing cereal on the head. Say all the cereal names, right? But yes, saying like, that's not okay. I don't like you doing that in my head. And standing up for yourself, that's where boundaries are born, right? I love that reminder. So when you say use them as the tools they are, how do I use an emotion that's really uncomfortable as a tool?
Yeah. So I'm just going to keep sticking with anger because it's so good and it's so under talked about. So with anger, if it happens that somebody is poking you on the head and say the cereal names, right? Anger comes up, and the time to use it is when you feel it, right? Because there's so many times when we go past a moment and we feel angry, and then anxiety occurs because we let the anger ferment. We didn't use it in the moment, and so we get resentful. At the person, we think sometimes that it's because of what the person did that's causing our anxiety. But I think more often than not, we're resentful at ourselves for not standing up for ourselves.
Amen. We point the finger, but the truth is we're not honoring ourselves, right? So I love that. So when it happens in the moment, I'm angry, my brother's poking me in the head, telling me to name cereal names. What do? You
establish the boundary. You have to stick up for yourself. with that anger, and you have to identify the emotion that you're feeling, right? And this is where it gets tricky because people are afraid to say what they feel. But in that moment, you say, hey, what you're doing makes me feel really mad, really upset, right? The key is getting to the heart of what you're actually feeling, not just saying something like more surface level, like I feel frustrated with you, right? You got to get to the core of it. So you poking him in the head, that like makes me angry. And at the end of the day, that makes me like sad. It makes me upset that like you're someone I care about and my relationship with you is damaged by like what we're doing.
How would I know how I'm getting to the core of it? I mean, as you're saying that, I think, would I really know that? Would I know that like, oh, it actually, like the first initial thought would be that hurts and it's annoying, but actually underneath it is it makes me sad. Like, how do I know that in the moment? That what's the core of it? When you said you've got to get to the core, how do I get to the core?
This is where the practice comes in. And it's getting very good at identifying physical sensations in your body.
Okay.
We don't feel, sometimes we think we feel emotions that they're all in our head. They're actually just in our body. We feel them physically, right? If I'm angry, I mean, you can think of your reactions. Fist clench, right? Nostrils flare, shoulders tighten, heart starts pounding, chest tightens up, right? If you hold that for a few hours, a few days, a few weeks, you're going to feel terrible. That is peak anxiety right there as you're feeling it in your body, right? So in those moments, you got to recognize, hey, I tell often my male clients, I'm like, just describe your emotions as how you're feeling physically and it'll go fine, because that's being honest.
I love that. That actually feels easy. How I'm feeling physically. If I can describe that and explain the sensation I'm having, that feels a lot easier than maybe going, okay, what's underneath this? What's underneath this? Just, yeah, this is what I'm feeling physically.
Yeah. And you describe it physically, and then we get good at recognizing those physical feelings, and not just in the hard conversations, but throughout the day. Figure out, man, what am I feeling right now? Why are my shoulders tight? Am I frustrated with something? Am I angry? Maybe there's some sadness tied to that. And all of a sudden we start bringing those emotions up, and what do they do? They anchor us in the present. There's a reason that all the most vivid, beautiful moments in our life were also the most emotional ones.
Yeah, that's such a good point, because it makes us anchored in the moment. So when you talk about this, we're being anchored in the moment, it's in the present. How does that change my anxiety? How does that correlate? Help me to understand that.
Because anxiety does not exist in the present.
So if I'm honoring my experience, I'm speaking what emotion I'm feeling, that requires me to be in the present.
Absolutely. Yep.
Got it.
Anxiety only exists, as we were kind of talking about before, it only exists in the past and in the future. If we try to spend our thought energy in places, and when I say that, it's more just places that we kind of perceive to be the past and the future, because
we can't remember our birthday cakes.
Right.
At least I can't.
Yeah, it's not actually the past or the future. It's if we try to spend all this energy worrying about what we did or what we should have done in that moment when we were angry, or what we should do in that hard conversation in the future, then we forget what we want to do now, and we miss out on all the beautiful things that are happening in the present. And that's those emotions that we can feel.
Yeah. So did you experience this? Like, was this when you said, I look at it totally differently? Is this what changed for you, the anxiety?
Yeah. It's just realizing that I wasn't spending time in the present. That was the core of it. And what would get me in the present is if when I was angry, when people said something, that I would say something about it. I would let them know, hey, like, that doesn't feel good. Please don't do that again. Identify the behavior, set a boundary. If you do that again, I'm not going to hang out with you. I'm not going to be here, right? And follow through on that boundary. If you do that, there's no anxiety, because you're not worried about what you didn't do. You stood up for yourself. You validated your anger.
Can we just like pause a minute, because that's a big deal. I mean, that you did that, and that you're able to say like, this is the problem, this is the boundary, and honor yourself. Like, that's no small task, especially with someone with social anxiety. I would imagine that didn't just come overnight.
Oh no, that was a lot of trial and error in figuring it out. It started to click, I think, in some moments where honestly it made sense. I love being in nature. I love being outdoors. And I think it's awesome and so pure, because when you're out in nature, you're just locked into the moment and you're happy and you feel good. And that's when it clicked for me, as I was like, wait, the reason I feel good is, I mean, I love being here, but I'm totally just locked into what I'm doing. And why can't I do that more often at home? Why can't I do it at work? It's more complex sometimes, but you can do it.
Oh, that's like such a good thought. And I've thought the same thing. My two favorite activities are mountain biking and skiing. And I love them. And yes, it's thrilling and it's outdoors and all these things. And I have to be really locked in when I'm doing those things. I can't have my brain other places or I will get hurt. I will fall. And I think that's the exact, I've realized that it's my brain focused on one thing, and I can't be thinking about what I need to be doing at home or what I should have done here. It's actually just locked into the present moment. So I love that we can do this, not just when we're outdoors or when I'm mountain biking or skiing, but we can do this in our workplace and in our homes. We just have to be a little more aware of it and practice it.
Yeah. And validate those emotions, because the reason it's awesome is because you're experiencing in those moments emotions in their purest form.
Because they're actually happening in the moment.
Yeah.
Not like going back to it, but I'm experiencing it.
Yes.
Yeah. That's awesome. Excellent. Well, Blake, I love this conversation. And part of it is, we were talking before the podcast and saying both of us have had a lot of anxiety and done a lot of work around anxiety. It's the reason I went to therapy, became a therapist because of that. And I think, you said the same thing. So it's a fun conversation to have, because I think we both come at it from not just a professional lens, but a personal lens as well. Is there anything else that comes to mind as we're talking about this that I didn't ask you or that you want to share with our listeners?
Just a really short thought. I would just say that you will feel so much better when you start giving credit to how you are feeling, right? Even if it feels silly logically. Emotional logic works on a different scale. And if you feel it, it's valid. And if you can start respecting your own emotions enough to validate them yourself, that's when it will change in your relationships. I
love that. And again, not having shame around it. I think sometimes we go, I'm feeling this way, but I shouldn't. I don't know why. It's kind of stupid. I mean, can you think of clients that say that time after time? I mean, it's kind of dumb, but this is what happened. Instead of, no, it's actually valid.
Yeah.
And it may not be a big deal for you, but for me, it was a big deal. And just honoring that.
Absolutely.
So yes, I love that. So a couple of things that I want to recap on is the clear difference between stress and anxiety. Stress is external, anxiety is internal. That they can sometimes perpetuate each other, but that's the difference between the two. I also appreciated that you said, people are hesitant to let go of the future, that you had clients that were in the 80 percentile range of that's where their thoughts were, that it feels a little bit scary to let go of the future. But really, how often do we actually help our future by worrying about it?
Never.
Never. Never, right? Again, the understanding that emotions aren't the enemy, that they're information, and you said they're tools that keep us anchored in the present. I want to use that. I want to ingrain that in my mind. They are tools that keep us anchored in the present. Gosh, then thank goodness for emotions. We need them. We're not trying to get rid of them. They're there for a reason to help us stay anchored in the moment. Such a great reminder. And that physical sensations will tell us what we are doing, what's going on inside of us. And if we're having a problem getting to the core of it, go back to those physical sensations. Did I miss anything?
No, I think that was a great summary. The only thing I would throw out there is for those people that heard that worrying about the future won't help anything, right? There will be some doubters there. And I just want to throw out that if we're living in the present well, we will account for the future in the present. We'll do what we need to do in the now, and we'll take care of it. And
Absolutely.
So that's some trust in our emotions that needs to happen.
Absolutely. I couldn't agree more that having trust in that we will take care of the future. That's what we do. We're built for that, right? Excellent. Yeah. Well, Blake, thank you so much for your thoughts. I love the question. I appreciate the honesty of this listener. And again, the vulnerability of saying, you know what, it's not working. And I need some help around that. So thank you for those tools and really practical tools. I really appreciated that. And for all of you listening, if you felt like this could help you or someone you love, please share it. I actually know it can. I think of the people we see, Blake, so many of them are suffering from anxiety. And sometimes it's this silent suffering that happens. So please share it with those that you love. I know it can help. And some of these tools that are so practical can be so valuable. And we appreciate you being here. Thank you for listening. And until next time, take care. That's a wrap for today on the Therapist Question Box. I'm Lindsay Schiss. Thanks for listening. And remember, every question you ask is an opportunity to learn and grow. Brought to you by Therapy Utah.
Hey, this is Kathy Kinghorn. I'm an owner at Therapy Utah. If you'd like to book with one of our trauma-trained therapists, go to www.therapyutah.org. Thanks for listening.